Oh, nobody's showing their face to us today. Come on, people. We want to see you. Everybody's got rainy day vibes happening. There we go. Thanks, Jane. Just going to give it a few minutes while we still have people signing in. So if you just don't mind signing in and maybe just saying where you're signing in from in the chat log, we'll get that going. If you have questions already for Dr. Zanis, then you can already start putting questions into the chat log, but let's give it a couple more minutes. For those of you just signing in, we're just giving it a few minutes to let more people log in before we kick off. Great, seeing some different names today. That's nice. Jaya, is that how you pronounce your name, Jaya? Jaya, yeah.
Yes, 2 short A's, Ja, yeah.
Jaya, Jaya, yeah, very nice. Signing in from one of my favorite places is Wellfleet.
It's pretty misty and rainy here now.
I know. We got a glorious day last week? No, 2 weeks ago, April vacation. We went and did the Jeremy Point hike.
Wow.
Such a great hike.
Yeah, it is. It is.
Yeah. Okay, it looks like the logins are slowing down, but I'm going to keep an eye on those. I'm just going to do a few just housekeeping Zoom rules. Want to let everybody know that we are recording this event. So this is being recorded and that we ask that you go ahead and you keep your mic, you stay muted. That way we won't get any background noises. And that if you have questions at any time, just go ahead and start putting your questions in the chat log. If you're also inclined to say hello in the chat log and just where you're signing in from, we always love to see where people are signing in from to get a better sense of our audiences for these events. But I'm going to go ahead and just do a quick introduction of Dr. Sylvia Zanis, who is joining us today from the Biomed Center of New England up in Providence, Rhode Island. She heads up the well-rooted dentistry component of the Biomed Center and is the head dentist at the center. And she's joining us to talk about the differences between traditional dentistry versus integrative biological medicine dentistry, and how that is viewed differently from the patient perspective and also from her perspective, how she goes about treating the patient. So without further ado, I'm going to pass it off to you, Sylvia. I know you have a presentation for us today, and then we'll make sure there's plenty of time for a Q&A period at the end. So.
Awesome. Thanks for the intro.
You,
so I'm just going to share my screen here. And just make sure. Does that look like we're good?
We got you.
Running?
Yep.
Okay. All right. So yes. So well-rooted dentistry at the Biomed Center. These are some of the talking points that we'll go over today. The big difference between biological dentistry and general dentistry, the main reasons that patients come to us, chronic disease, and then the specific kind of dentistry that we practice here. We'll go over 4 supplements that are absolutely necessary for healthy teeth and bones and gums, and then just dental products and home care, hygiene. Everyone loves those questions, and then we'll conclude with any questions. Just a little bit about me. I'm from Michigan, attended Michigan State, and then University of Michigan School of Dentistry, go Blue. I came out to Boston for a 1-year residency at BU. I practiced in private practice for about 2 to 3 years. And then I discovered biological dentistry, and I became accredited by the IAOMT. This is a really great resource for dentists and patients. The IAOMT was founded in 1984 with goals of protecting public health, scientists, and dentists, hygienists, other professionals that really care about the research. Goals of having the safest, least toxic way to treat patients. And then Swiss Dental Solutions, this really kind of brings home the whole biological concept that we practice closely here, remove disease and toxins, and then being able to replace any missing tooth structure in the most natural way possible. And then currently on track to get my naturopath degree in June of this year, which is very exciting. So I'll just start with my patient story. My first introduction to biological dentistry is when I was practicing at a general dentist practice out of school, where we were placing and removing mercury fillings. I had a patient come in. First day I met her, she came in with a walker, and she said, "I need you to remove all my mercury fillings. It's making me very sick." And this was really the first time I had heard of this. In dental school, we were taught mercury is safe, it's fine, it's not going to affect everyone, kind of this one size fits all idea. So this patient introduced this to me. I said, well, let me do some research and I'll look into this. So doing my research, learning that mercury vapors come off of the fillings with eating or drinking warm temperature foods or drinks. And depending on how many fillings a patient has, you can have a lot more exposure past the acceptable limit. So my patient, she had a biocompatibility test and learned that she was allergic. So we did confirm that. And she kind of talked me through safely removing all of her fillings. So after about a month or 2 of removing them, she was completely mercury free. And at the end of it, she was walking without a walker. She was able to dance at her son's wedding. That was her whole goal. So this was like the most compelling story I had ever seen. And then from that day, I vowed to never place or remove mercury unsafely again. So it was just really interesting. You don't know what you don't know. And just being open that, it's not a one size one-size-fits-all approach. And then kind of getting into biological dentistry. It really, all dentists are trained the same in the US. And then this biological dentistry starts as a concept. So root cause and chronic disease is kind of the umbrella. We understand that chronic disease doesn't happen overnight. And for the most part, all dental disease, it's preventable and it's chronic. So it's something that's been ongoing. By the time we see a cavity or a lot of inflammation, we know it started with step one, that there was a regulation disturbance. And this is the part that we really we aim to treat as biological dentists, especially because a lot of inflammation and toxins do come from the mouth and can come from dental materials. So we'll always start with this nutrient deficiency. And then the second phase is a functional disturbance. So we have impaired cell division and the body loses this ability to compensate. And then we have the structural disturbance. So cavities show up, symptoms show up. And this is where, allopathic medicine and dentistry tends to treat at this bottom of the food chain. But it's really important, like we said, to get to the root cause and to treat right here. So biological dentistry, root cause. People typically think, going to the dentist is a place where you go to get things fixed. So after it's already happened. So we really, we want to take this proactive approach to treating patients. We don't want a patient to come back from their recalls and every time have a new cavity. We want to address why is this cavity forming in the first place, address sleep, diet, nutrient deficiencies. It's also a very individualized approach. Like I said, we go through, we have a lot of time with our patients. Here we have a 2-hour new patient exam. We take a thorough history and then we really just, go through the root causes of things that are showing up in the mouth. Here we have dental materials allergy testing because a lot of patients, about 17% of the population is allergic to nickel. And nickel is found in many dental materials. It's found in older crown materials, something called porcelain fused to metal crowns. Trace nickel is also found in titanium implants. And patients can have this reactive allergic reaction to it. It can be acute or it can be delayed. We do saliva testing, which I'll get into that. I'll show you an example of that. Vitamin D testing, this is really important. Before we do any kinds of surgeries, having vitamin D at the optimal level is important for quality and quantity of healing. Procedurally, we use Ozone, which I'll get into, laser, PRF, and we use the most biocompatible composite on the market. If there's ever any question, we will always test the patients, draw their blood and test it against this material. A cone beam, this is a special X-ray that I look at and we send out to our radiologists and they give a comprehensive report. And we are a fluoride-free practice as well. So we'll kind of talk about these points as we go along. Sorry about the formatting here, but these are really the top 5 reasons patients seek us out. The first one would be to have their mercury fillings evaluated. So we look at, we can even look at genetics, see what a patient's, detox is like. How can they detox? Do they detox well? I like working with a functional doctor on this and just making sure it's safe for a patient to have these mercury fillings removed. It's very important that the detox pathways are open and working when we're going through this process. We also do a root canal evaluation. So, there's a spectrum of biological dentistry. Some biological dentists will say, take out every single root canal you see, there's no place for it in the body. And then on the other end, people will say, it's okay, you can leave them, maybe we can do ozone. And I think I fall somewhere in the middle of that. Again, going back to that individualized approach, you have to meet patients where they're at. If, losing a tooth is a really emotional experience, and it can be devastating, especially depending on where that tooth is in the mouth. So taking a thorough history of the root canal, and then looking at that cone beam X-ray and seeing if there's any inflammation around the root or if it was thoroughly filled, that can give us a lot of clues if we want to keep the tooth or if we need to extract it. We'll also look for inflammatory markers like C-reactive protein and some of the interleukins to see if there's any unexplained inflammation going on in the body, because a lot of it can be from the mouth. Ceramic implants, this is a way to replace missing teeth, and dental materials testing we talked about. So SMART, that stands for Safe Mercury Amalgam Removal Treatment or technique. So this is a picture of my assistant Sandra and I in our SMART room. We have special filtration. We use something called a rubber dam, and this minimizes all the techniques that we use here. This was developed by the IAOMT, and this reduces vapor or particles from the for a patient to ingest or to inhale. This is the full checklist from the IAOMT, which we follow. So this is the safe way to remove mercury if a patient's ready for that. So then getting into X-rays, this is part of our comprehensive biological evaluation process. And I'll just give a couple examples here. This X-ray right here, this is called a bite wing X-ray. This is typically taken annually by your general dentist. This gives us information about cavities forming between the teeth or on top of the teeth. It does show us some bone loss, but our mouths, our teeth, they are 3D. And this is just giving us a 2D image of that. So a lot of things are superimposed on each other. This is an example of a panoramic X-ray. Again, this is great. We can see the general overview, but it's missing a lot of the details. You can see a little bit of the sinus and the bone quality. And then the difference with this is our cone beam X-ray. This is an example from one of the cone beam reports. So we are able to actually see the inner workings within the jawbone directly surrounding the teeth and any inflammation going on. And we can see here, we can see cysts in the sinus. So this is really, really helpful in finding hidden infections as well, and seeing like the extent to inflammation in the bone. Something else that we use here, we use ozone. We make fresh ozone water every day, and it's in all of our units. So ozone is just 3 atoms of oxygen. The extra oxygen is very unstable, so it's great. It binds and it knocks out any free radicals. So it's oxidative and it has a cumulative effect. It's antibacterial, antiviral, and antifungal. And because it's oxygen, there's virtually no side effects or reactivity to it when it's used properly. We use it in water form every day, every procedure. I use it in gas form for the majority, actually probably all of my procedures, any kind of a filling, I'm able to use ozone gas. After we clean the tooth out, the tooth is very porous. So we spray ozone gas around the tooth so that can penetrate into the pores. And this is great because that means I'm removing less tooth structure, and I'm able to have a clean environment to put that filling on top of. You can also use it in oil form. It can help with tooth sensitivity, very small areas of demineralized enamel. So this is like the very start of a cavity. We're able to use this to remineralize the area. And then we have salivary testing. We can do this chairside and just collect a sample. This is really great because it's very personalized. So it will give us the quantity of bacteria and the types of the bacteria that are in the mouth. So periodontal disease is systemic. So sometimes we need to do a little bit more than that localized treatment. Sometimes we need to use a specific antibiotic, or we use laser around the mouth. And ozone also really helps if we're concerned about the pathogens involved. And then it goes a little bit further to tell you about the specific pathogens and other correlations in the body. So we have risks of cancer, cardiovascular health, joint and muscle health, dementia, brain health, Alzheimer's, metabolic, and pregnancy. Okay, so PRF, this stands for platelet-rich fibrin. This is another therapy that we offer at the center. And what it is a patient's blood is drawn, and that blood is spun down in a centrifuge. And we use this during surgery. So if we're removing a tooth, or if I was treating a spot of inflammation in the jawbone called a cavitation, we use this to help with quality and quantity of the healing. It is stem cells, it's liquid gold. You can use it in a lot of different ways. It reduces inflammation and reduces risk of post-op infection. So when we use this after a surgery, we'll take an X-ray in about 6 months, and the healing is always really beautiful and predictable when we use PRF. So the Fantastic Four, we call them: vitamin C, magnesium, vitamin D with vitamin K, also called MK7. These are really, the 4 supplements that will help with bone and teeth health. So healing from the inside. Vitamin C is the ultimate antioxidant, and it also helps with collagen, which is about 33% the other part of the tooth structure. Magnesium has this yin yang with calcium. Teeth are made up of calcium, so really important. Vitamin D regulates calcium. Vitamin D and vitamin K should always be taken together. Really important to have the proper ratio of that. I do like to defer to patients, naturopaths, or functional docs when working with this. We always want to get a baseline before just blindly, having these recommendations. So that's extremely important. Getting into home care. Everyone always wants to know, what toothpaste should I use? So important to have a great topical toothpaste, but also, the diet and the supplements are important as well. Fluoride, these are a couple of resources here that will give a lot of good information about research and how fluoride can impair cognitive development in children and affect endocrine function. And then these are a couple of other ingredients that I would say, you definitely want to stay away from. For going off the toothpaste again, the toothpaste that we love, Boca, Risewell, Revitin. there's an ingredient called hydroxyapatite, and this basically it has the benefits of fluoride without being a neurotoxin. So it will help remineralize enamel. So if you're looking for a toothpaste, I would look for one with hydroxyapatite in it. Mouthwash, avoid alcohol. The majority of the oral cavity is made up of your soft tissue. So you don't, want to add something that we think is good for the teeth without respecting the tissues as well. Stella Life is one that we love. Proper use of an electric toothbrush. A lot of, patients come in and they have, very aggressively brushed their teeth to the point where their gums are worn away and receding. So really making sure, a toothbrush that has a pressure sensor can be very helpful for that. We prefer the Sonicare toothbrush. Floss, cocoa floss, if you've ever tried it, it's great because it traps the plaque on that floss, and you can actually see it. Some of the other wax flosses, they might slide really easily through your teeth, but you're not actually trapping the plaque. A tongue scraper is wonderful, especially first thing in the morning, stainless steel. Then you can throw it in the dishwasher to clean it. This will help, with morning breath and reduce the bacteria that have accumulated overnight. Water pick is great. Again, it kind of depends on, if there's missing teeth or recession, but this can be very helpful. Another, therapy that we have recently started recommending is nebulizing with hydrogen peroxide. Dr. Levy, he's a cardiologist and a lawyer. He wrote Hidden Epidemic and some other books on correlation between systemic health and oral health. He, really drives home this point that we can't heal a leaky gut without starting at the top. So, all day we're swallowing lots of bacteria, and a lot of people have low stomach acid. So those bacteria are going into our gut. So, if we're looking at the cone beam and we're seeing inflammation in the sinus or cysts, then we'll recommend using a nebulizer. And then not to worry, if you're not currently at a biological practice, it's okay. You can have respectful conversation with your general dentist and ask about materials that they're using, or if you have concerns about fluoride, ask, if fluoride is typically in the polishing paste during a cleaning. It can be coated on floss, and it can be used in certain materials. So that's a good question to ask. Or maybe starting out with a cone beam and just being able to rule out any hidden infections or have your root canals evaluated. And then these are ways to get in touch with us. These are our Instagram handles, our direct dental phone line, or you can email us if you have any questions.
Awesome. Thank you, Dr. Zanis.
Open to questions.
Yeah, so we do have some questions that some of the folks have sent in, and I see questions coming in the chat box. So please keep the questions coming in the chat box and we will get to them all. Maybe if you want to stop sharing the screen, we can see you in a bigger way.
Sure.
That'd be great. And then we'll get to questions. So there was the question of whether or not we would be sharing the slides and information, and we will. We end up, once we bring all of the information together, the notes, the recording, the slides, we post it to our Marion Institute resource page, Biomed resource page, which you can access, and we will send an email out to anybody that's registered for this program. So you'll get that follow-up email, and usually that goes out within the week. So that is coming. I'm going to get right to the questions. Dr. Zanis, if you're ready for them.
Yes.
What's the best thing to do if you have irritated or inflamed gums?
Okay, good question. So it it kind of depends. So if there is generalized irritation, bleeding everywhere, you would definitely want to start with a professional cleaning. If this is accompanied by bone loss, something that's been chronic and ongoing, we would maybe want to take a saliva test and see exactly what kind of pathogens we're dealing with. Is it a specific area? This could be something localized. Do you have a really deep filling? Is there a crown material that your body is not agreeing with? Is there spacing? Is there orthodontic treatment that may be needed to fix this? So if it's a specific area, we can, most times likely get to the bottom of that and treat that specific area. If it's generalized, start with a professional cleaning, preferably with ozone.
Okay, excellent. My 38-year son had a periodontal disease for 20 years. Last week required a bone graft to his gums. Is there anything you can suggest to help overcome this disease besides every 3-month visit a periodontist? Maintaining good hygiene, like what else can he do?
Yeah, so this, if there's a point where a graft needs to be done, bone grafting or soft tissue grafting, why did this need to be done? So it could be needed for a couple of reasons. One could be, aggressive home care, brushing and flossing. It depends on the degree of it. The second thing could be malocclusion. So how do the teeth line up? If the teeth are really crowded or they're not hitting properly, this is a very quick way to bone loss and recession. So having the teeth in the proper arch alignment, so the forces of when you're biting are directed down the root the way that they're supposed to, that's getting to the root cause. So we would maybe want to see if there's ortho treatment that needs to be done. Another thing could be the muscle attachments on the teeth. So if a muscle attachment is very high, you're going to constantly be pulling at your gum in that area when you're talking or chewing. So that's something that could be lasered and fixed as well. So, it's kind of tough to say, but what?
I said, that's amazing. You wouldn't think that those things could have such a, like your bite would have such a detrimental effect on your bone graft like that. Yeah.
Yeah, absolutely. So if a tooth is angled, where that tooth flexes, you'll lose your tooth structure. So I would say alignment would be the first thing to look at. And if that's all good, then ozone or getting to the bottom of exactly what kind of pathogens we're dealing with.
This is a funny question. So why does my tongue burn when I eat certain foods?
Okay, so this could be a couple of different things. So the first thing, does the tongue have a deep groove in the center of it or a deep fissure? Because this can trap more bacteria and make you more sensitive. A fissured tongue can also tell us that there's GI issues going on. What is it when you're eating certain things that are acidic? Address the products at home. Sodium lauryl sulfate can create a lot of sensitivity in the mouth. This can also be a vitamin deficiency. So B vitamins, folic acid, or zinc, those can create, or if you're deficient in those, you can have burning tongue or burning mouth as well.
Okay. In the case of resection from a root canal where the tooth is extracted, is there anything to be done to the jawbone, or will the body kill remnant bacteria infection naturally now that the source of infection is gone?
Okay. So exactly right. That tooth is that source of the infection. When we have a root canal tooth like that, we remove it. We remove the ligament surrounding that tooth. This is very, very important because a lot of the bacteria hang out in that ligament. So, making sure there's a removal of that. Also, any ligament that's left behind will tell the bone you could not fill in here because this is a ligament. So it's very important to have that cleaned out. If then we would use PRF because that will help with the healing of that area. That will signal to the body, hey, stem cells, we'll give you a scaffold to regrow. If the tooth was taken out, a while ago, it depends on what it looks like on the X-ray. If it looks like the bone has filled in pretty well and we can check the density on that, then you could do something like ozone injections in the area, and that would help clear out remnants.
Mhm.
If the bone does not look like it's filled in, the body isn't always able to heal in that area, especially if there's still ligament behind, because the blood supply, that's what's going to heal and take away those bacteria. So they can get trapped in those areas. But ozone injections would help.
Dr. Zaina, do the traditional dentists remove that ligament, or is that just something that happens in biological dentistry, or is that just a standard?
So it's not a standard. I would say there's very differing opinions of ligament removal in the general dentistry field. Biological dentistry 100% every time removes that ligament. It's extremely important.
Thank you. Does any insurance cover these procedures, as they sound expensive? Always the question.
So
A good one.
I'm going to defer to Amber. She's our
she's in Aruba.
she's in Aruba. So we are out of network with insurance providers, but we do a courtesy and we submit anything that we've done to your insurance. So for this practice, you would be responsible for whatever we do at the time of the visit. And then the insurance would give you a reimbursement check for whatever it is out of network. But we do work with patients, we phase out what's most important, and we want to see people get better. So we want you to.
You guys worked with me, and it worked for, you definitely work with the patients. So
Good.
Exactly what kind of testing is used to determine material compatibility? Is it performed on site? Do you use Clifford Labs for this?
Mm-hmm. Yep.
Very pointed.
Yes, someone that has done their research. That's awesome. So yeah, Clifford testing is one of them, and then ELISA testing is another one. We do it on site. It's a blood draw, and we usually get the results in about 3 to 4 weeks.
Okay. I have failed implant, which I believe is zirconia. My dentist has agreed to replace it, no charge, but I'm concerned because they don't use ceramic implants.
Okay, so zirconia is a ceramic implant. So maybe they meant a failed titanium implant by chance. So, titanium, like I said, so you can have a materials test, reactivity test to titanium, which I think would be a really good place to start. Zirconia, is metal free. It doesn't have any free ions to interact. And the tissue adheres to it very similar to tooth structure. So we get much less inflammation around it. So our recommendation would always be to go for the ceramic implant. We've taken out titanium implants, and then we have to do a very thorough job cleaning out the bone, because those metal particles can get in that surrounding bone and gum tissue and can continue to affect that area long term.
Yeah, so James, I think going back and finding out if it was actually titanium versus zirconium might be a good place to start. Chances
also,
are.
they did, there was a study that came out that found out cell phone use actually heats up the bone surrounding the titanium implants. So that was interesting. Yeah.
So it becomes like a conductor, right? Like it becomes a conductor for EMFs.
Mm-hmm. Exactly.
Great. What would an ongoing sore on the upper palate indicate? Cavitations around root canals?
I guess it depends on where it is. If it's ulcerated, is it red? Is it raised? I mean, it could be an irritation in that area. If it's close to a tooth, it may be directly associated with that tooth. If it's close to a tooth, it could be something called like a fistula. So that's the body's way. If there's an infection inside, the body makes a little channel to let the inflammation out. So it depends. And then any like past history of smoking or alcohol use, that would affect, the diagnosis as well.
Okay, Susan, you're on here. And if you wanted to add to that question in the chat, I'm happy to follow up. I'm going to go to the next one though. I brush my teeth at least twice per day and I see a dentist every 6 months. And yet I always have extreme plaque buildup. What could be the problem?
Okay, so so the calculus buildup typically on the backs of the lower teeth. So this can tell us that there's a lot of calcium in your saliva. It also depends on how the teeth are aligned. So if they're crowded, most definitely the plaque sits there and you'll have that buildup. But that sounds like a calcium imbalance. So I would say, working with a functional doctor and diving a little bit deeper into that. Like we said, magnesium, vitamin D, vitamin K, all of those things affect how the calcium is deposited and how much you have in your saliva.
Excellent. You mentioned antibiotics. What are the antibiotics that you use or prescribe? That's the first part of the question. So I'll let you answer that and I'll go on.
Okay. So it depends on what bacteria that we're trying to treat. The universal antibiotic for dentistry is penicillin. This is, broad spectrum. It treats a lot of like the oral microbes. But with that salivary testing that we have, they will tell me specifically what antibiotic will correlate with, the pathogens that they found specifically. And it depends on patients' allergies as well.
Yep. How can you stop bruxism, teeth grinding, not just using mouth guard to minimize damage?
Yeah, so bruxism, we're finding, traditionally we would just say, oh, it's just stress. But now we're learning that the airway has a lot to do with it. So having a full evaluation, can the tongue move? Is the tongue tied? What does your palate look like? Have you ever done a sleep study? Even have you ever just worn, something that would track your sleep overnight and seeing how many apneic events that you have? It's probably an airway issue, but that would need to be evaluated.
Okay. I had a crown put in about 5 years ago. I believe it was titanium. I was having issues with my health and was told it was migraines, but was later diagnosed with POTS. Could the titanium crown be also affecting my health with regards to POTS?
Yes. So titanium is not typically a material that we use for crowns. So maybe it's a titanium implant or it's a metal crown. But absolutely that can have an effect on the body. But we would want to do materials testing and see what the X-ray looks like. Have you lost a lot of bone in the area? Is there something acute going on? We want to kind of build the case before jumping into any surgery.
Excellent. So you offer services performed by someone who has not been vaccinated for COVID-19? I think that must have been, do you offer services performed by someone who has not been vaccinated for COVID? I've read that being close to vaccinated people is impacting the health of unvaccinated people.
Mm-hmm. I did see that. Yes. So yeah, we are open to treating everybody. We use the proper PPE for all patients. This is something that we did even before COVID. Our PPE hasn't changed much at all, because it's important to protect yourselves and other patients.
Does that go into the SMART guidelines of when you're doing the mercury removal? And I mean, the Biomed Center has such an incredible room for when you're doing the mercury removal and the
ionizer.
If you want to give a little bit of information about that room, I won't do it justice. So I think that's important.
Yeah, so we use a specific room with ionizers in the room to improve air quality. We have special vacuums that we have very close to patients, to the mouth where we're working on. Also to help with that, we use forced oxygen, and this will help so the patient is not breathing everything back in through their nose.
Okay. I think Susan has followed up on her, the ulcerated area at the top of the mouth. So the area is area swollen running along the line of teeth and sometimes tender. I was told that it was herpes, but it does not come and go. And I have a line of root canals and 4 teeth in a row along that side.
Okay, I would say have that evaluated with a cone beam, because we know there's no such thing as a sterile root canal, and they're a sterile root canal tooth, and there's a lot of bacteria escaping. So I would, have that evaluated. It's tough to say without seeing the specific lesion.
Okay. For most of my fillings and filling replacements, I need to return to the dentist to remove high areas of the new filling. How do you ensure that the new fillings are a good match for the opposing tooth?
So it depends on the filling material. So the brand that we use flexes similar to the tooth structure, as close as you can for it being biocompatible. So if you have metal opposing natural tooth, that natural tooth is going to wear away much quicker. I don't know, we use a brand called Voco, but I'm not sure about, the other composites. It's tough to have the perfect material that's going to wear exactly like enamel, but still keep the seal. So I can only speak about the material that we use.
Excellent. Follow up to the vaccination question was asking if staff at the Biomed Center is available that have not been vaccinated. And you can choose to answer that. I feel like we always vaccination I find is a very personal question.
It is.
I'm not sure if the entity being a medical institution was required to get vaccinations to be able to operate. So you're calling, you want to answer that, but you don't have
to. I would love to have this conversation personally. But we have staff that have views across the board on this, but we can have a specific conversation, private conversation. I'm happy to, be completely honest with you and share that with you. So
thank you. I think that's perfect. And you've already provided your contact info. So thank you, Sylvia.
Yeah.
I don't know if there's for most, I think, Jeff, I think I got yours. Okay. So I'm going to go back to some of the ones that were called in on some reports. Sure. I think you covered this, so I'm going to bypass that unless you feel like there was anything left of what's the difference between like a visit going to a biological dentist versus going to a traditional dentist. But I think you did a really good job of walking us through the different technologies that are used at well-rooted dentistry. And if anybody has further questions or wants more information on that, throw it in the chat and I'm happy to come back to that. I'm looking to see if there are what are other daily habits you recommend for optimal oral health and hygiene?
So tongue scraping, absolutely. Oil pulling, but only like 2 times a week, because that
That's my
can,
jaw.
yeah, exactly. And it, we don't want to kill all of the bacteria, so that really removes everything. We want a nice, delicate balance. So doing that a couple times a week, great. Mouth taping is something.
That's what I haven't heard. Tell more.
Yeah, so this goes back to the airway, bruxism, quality of sleep at night. A lot of people don't even realize that they are breathing through their mouth. So just, giving mouth taping a try, and this will ensure that you are breathing through your nose.
Are you like literally putting tape over your teeth and
over your lips? There's like something much nicer than like the Scotch tape.
Yeah, this sounds kind of traumatic, but
yeah. And then, this is just like a great way to experiment for patients, to try it for a week and see if they wake up feeling refreshed, or if they wake up and they find that they're not bruxing as much. Yeah, that would be another one. What else? Food wise, frequency of snacking. That would be a big one. If you find that you're having a lot of cavities, and you feel like, or if you're just concerned about that, snacking throughout the day, the bacteria in our mouth break down these food particles, and their byproduct is acid. And then that chronic acid exposure is what demineralizes your tooth structure. So frequency is more important, I would say. So if you're going to go for that sweet snack or something sticky, just do it, eat it all at once, and then rinse with water after, but don't graze. That's also better for your digestion too, to just have it at once.
Question of what oil you recommend for oil pulling? Is it always coconut oil?
Yeah, coconut oil. That's what I would use.
Yeah. Yeah.
But I've seen, people recommend different things. There's coconut oil. You can drop a little essential oils in that if you want some peppermint. Yeah, or you can buy that pre-bought with that as well.
Okay. Okay, well, I feel like we're rounding it up with our questions. Most of the other questions that we had have already been answered. So
Okay.
I don't know if anybody has any final last questions or thoughts for Dr. Zanis. Again, if you want to, I think that Patty, my teammate Patty, has posted information into the chat log about our next BioBites. And Katie, if you could remind me, what is our next BioBites for June?
It's on addressing root causes of anxiety and ADHD, and that's with Maureen Burford of Creative Lives. Yeah.
Great. So that registration link is live and you can sign up for June. We look forward to seeing you all again. Any other last minute thoughts before we part ways? Dr. Zanis, thank you again for taking the time out of your day to spend with us and to drop some of that excellent knowledge on us, and we appreciate it. I did put in the chat log that you failed to mention that you were nominated as top dentist when you were in Boston by all your peers. So just throwing that out there for you.
You're my hype girl.
Wait, we have, is a root canal out of the question? I'm not sure. Oh, you mean just in general, Sandra, you're asking like, do you never get a root canal? Should you never get a root canal? I think that's what you're asking.
Yes.
Okay.
So I don't like, end all be all statements. If it's your front tooth and you're 18 years old, are you prepared to have it taken out and an implant for the rest of your life? It's a tough decision. So it depends also what else is going on systemically. Do you have chronic inflammation? Do you have cardiovascular disease, rheumatoid arthritis, MS? What else is going on? And then also, what does that tooth look like? Is there a huge infection around that tooth currently? Because if there is, it's very hard to get rid of that infection. Is it something that just started acutely and you're going to go maybe within the next week to have it done? You know, these are all things that matter, but I would say there's no end all be all statements, you know, with that. So
It looks like she's going to the dentist today and she's saying she's prepared for her dentist to suggest it. I think we just answered another question was, is there biological dentists throughout the country? And my teammate Patty just put a link to our finder on our site. Katie is our biomed program coordinator. And if you send her an email, she'll throw her email in the chat. She can help to find somebody if you're from another part of the country and you're looking for a dentist that focuses more on biological. And that resource that Dr. Zanis suggested multiple times, the IOMT.
Yeah, it's a mouthful.
Yes. They are really a great place to start too. I mean, they have a list of all of their dentists that are certified through them, and they do follow a lot of smart protocols. Maybe they're not exactly biological dentists, but they at least do follow a lot of the smart protocols for mercury removal and different things like that. So that also is another great resource. And I'm just going to scroll down, make sure I haven't missed anything.
And just whoever, you know, you're treating, I feel like, you know, I don't even need to say this, but even if they are a biological dentist or a functional, you know, you've got to really connect with them, and you got to, you know, have them show you the X-rays, ask questions. It's got to feel good. Yeah, so that would be my 2 cents. I can't believe how many patients come to me and they say, you know, I know this wasn't right. It didn't feel right. I wish I hadn't done this, but I just, you know, got talked into it. Or, you know, it should never feel like that. It should be a decision together.
Right. And that's an awesome point that you just made, and a great place for us to end. I mean, I think one of the, you know, we always talk about educating and empowering individuals around biological medicine and dentistry. And, you know, that's the point in doing these free, you know, BioBites, and it's really trying to get the word out, because, you know, all too often, especially around dentistry, I think, especially maybe it's just because I've been traumatized by dentists in my past, so maybe it's just me, but I think like you go and you sit in that chair and you feel like, okay, I've got to go with whatever they say and do whatever they say, and maybe not really understand the repercussions, or feel like you can press that pause button and go back and do your due diligence of some of your educating of yourself. So please check out our site, look at our resources, check out the Biomed Center and Well-Rooted Dentistry in Providence, Rhode Island. And just for nothing else, just to sort of empower yourself to know a little bit more and be able to sit in that seat and ask those questions. So again, thank you all for joining us today. Thank you, Dr. Zanis. I look forward to seeing you soon, and we'll see you all next month. Thanks. Bye-bye.